Hi, Chris Quinones from Rasayana here, talking to you for a few minutes today about performing like a pro. You know, working as a holistic practitioner for the last 12 years, I've encountered a wide range of circumstances in which my patience and my professionalism has been tested. And I think that a couple of specific areas that help really define the good from the great in terms of professionalism involve the following three things. Healthy boundaries, being able to communicate boundaries with our clients and patients, with other practitioners, with our time is critical. You know, working with the healing arts, you're often working with people who are in pain, people who are suffering, people who may have been suffering for a very long time. And so that can make for a very interesting dynamic therapeutically between yourself and your client or patient. And without strong, healthy boundaries and assertion skills, you can really burn yourself out. And so in my live training, I talk about the three-part assertion technique that I use with clients to assert my boundaries around my time, my scope of practice, and even other practitioners, and how I'm able to support what they're doing in meeting the overall goals. So that's the first thing, is really strong, healthy boundaries. Another one is being able to identify and respond to post-traumatic stress disorder episodes, especially during a bodywork session. In Ayurvedic bodywork, there is a lot less draping than is customary in Western massage. And so a lot more of the body is exposed, and there are areas of the body like the abdomen and buttocks and breasts that are massaged regularly in Ayurvedic massage that most Westerners just may not be familiar with or comfortable with. And I was really fortunate in my massage therapy training to have some training around post-traumatic stress disorder and be able to respond if someone goes into a dissociative state during a session, which has happened to me, both on the massage table and on a massage chair. I'm thinking of a particular event that I was doing chair massage for at Lesley University here in Cambridge, Mass. And a woman that I was working on had at one point during our session stopped and looked at me and said, I'm sorry, I don't feel well. And at that point, she was no longer able to maintain a focal point to me or anything else for that matter. And shortly thereafter, she began to experience a grand mal seizure. And so I was able to safely recognize what was happening and get her safely from the chair down to the floor and keep her safe until the seizure had passed. And once the episode had passed, I was able to clearly explain to her what I had observed and get her the medical attention that she needed. And it was a really important time for me and for her, for safety to be maintained, for her privacy to also be respected as best as possible. Here we were in this public setting, and she was having a grand mal seizure. And so being able to respond effectively and call for help from my colleagues and delegate tasks like holding up a towel or a sheet as a privacy screen during her seizure so that onlookers wouldn't be so tempted to stare and get involved. You know, I wanted to give her some privacy for what she was experiencing and be with her. until the episode passed, and of course be able to maintain a safe breathing airway for her, and just watch her, make sure that she wouldn't be further injured. And then of course being able to let her know that she was safe and that she was going to get the medical care that she needed. That was an instance where if I hadn't had the training that I had had, then she may not have certainly been as well cared for or felt as emotionally safe as she had. And of course, after the incident, I created a document incident form to explain what had happened. And, that incident just stays with me still, even though it was many years ago. Being able to stay calm, stay grounded, and be clear on what needed to be done was, I think, a really key component to differentiating myself from just your average body worker who comes and does these chair massages into a real professional healthcare practitioner in knowing how to deal with medical emergencies effectively and quickly. Another time that I think my patience, I'll say, was tested, or a time that my patience was tested, was with a new client, a gentleman from a foreign country, eastern part of Europe, who was very accustomed to his massages involving a lot of pressure and involving the feet, where the massage therapist would walk on him. And this is not something that I had experience with or training with, yet he was really insistent that this be done. And he didn't want to have any draping. He just wanted to be naked and free. Well, this is obviously far beyond what my comfort was and how I practice body work. And so I had to have the firm boundaries with him to explain where my limits were with regard to draping and experience. And this was how the session was going to run. And this was how I could help him and what I had to offer, as well as holding the space to sincerely and compassionately inquire as to why this approach was so important to him, and to not assume that he had some ulterior motive. So, having an understanding of where your client comes from and the fact that there are different cultural norms with regard to body image and being comfortable with one's body and how it's worked with is different in different parts of the world. And I was able to hold that space for this gentleman and let him feel heard and understood, and then inform him about how I practice and would achieve within my limits the results that he was looking for. And we were able to proceed with the session. I did not need to massage him with my feet, and we were able to accomplish the effects that he was looking for. But it definitely caught me off guard at first, wondering, why is this person coming to me claiming they've read all about me and know how I work, and they're asking for something that was completely outside of what I normally offer. Another example I would say is of poor behavior with clients, mostly around my boundaries around time. People who cancel late without a real justifiable reason, or they show up late for a session and are still expecting their full time, or someone who just simply has trouble relinquishing control and receiving during the session. And, how do you manage these personality types that are going to come into your practice in a way that's going to be effective and not burn you out? And, this is something that I think can never get under practiced. That even is, I'm not speaking very articulately, but I think it's something that is undervalued, I'll say, as wellness pros get trained. You know, I talk to a lot of other massage therapists who have trained elsewhere in the country or different parts of the world, and many have not had any training around the dynamics of therapeutic relationships, around how to develop and execute proper assertion skills and communication skills with regard to boundaries, and how to effectively develop business systems and communication tools to work collaboratively with other practitioners, and having the proper legal documents in place to protect yourself legally as well. And so these are the things that, to me, really differentiate performing at high levels of professionalism versus just getting by with a little shingle and your massage table. You know, massage therapy is a licensed profession, and it took many, many years in order for that to happen. And there's a reason for that. There's a great deal of training that we receive as massage therapists, both medically and, you know, personally or emotionally, with the metaphysical aspects of healing and some of the energetic aspects of healing. And it's something that I am really committed to and delegate time for in the live trainings that I offer, because, you know, I just have always been a high performer, high achiever, and it's how I operate and how I think I can share my talents with you, so you're performing like a pro and distinguishing yourself from the good as the great. So I hope that gives you some food for thought. And if you want to learn more about that 3-part assertion technique that I use, sign up for my live training and I'll walk you through it, along with a lot of other techniques you'll need to perform at peak levels. Take care.